Hi friends, I am Dr.Rohit Udaya Prasad, lead consultant at Aster RV Hospital, Bangalore, JP Nagar. I am here to clear out some information based on certain feedback we get or patients that we see in day to day OPD practice. One very common thing that we see in our OPD is hearing loss in the elderly. We do get in our OPD frequently patients who are hard of hearing of variable degree, who visit us either in their initial stages or who visit us when the hearing loss has been for a very long duration and have not taken treatment, or come to us for hearing solutions based on the kind of hearing loss they have because they have been sent across by someone else to get the treatment done here. Most commonly elderly hearing loss is seen in both male and female. It is not only specific to males or females. Hearing loss is either age related progressive hearing loss, can be genetic, which is either they have had hearing loss in their earlier days itself and has progressed quite severely as they have reached their older age. It can be a one sided hearing loss all of a sudden, which can be due to some other neurological reasons which need further evaluation, or it can just be a simple both ear presenting with hearing loss, either one going little bit more lower as compared to the other ear, but eventually they do present because they are not able to participate in the day to day activities. Either their children bring them along or they come themselves voluntarily. Most of the times is the family who brings these elderly gentlemen or ladies to our place to get their hearing evaluated, because either they are too shy to get checked or it is their ego which is coming in the way to check the hearing levels. So, when the patients come by and when we evaluate, most of them, when we find that they have hearing loss of more than mild nature, which can be moderate, mild to moderate, moderate to severe, or severe or profound, these are the patients who require some form of assistance with a device which can be as simple as a hearing aid, can go as in advanced as a cochlear implant. Hearing aid requirement for elderly hearing loss is a must, because one, it improves their hearing awareness, it improves their ability to communicate, it improves their ability to socialize, it improves their ability to retain memory because of the conversations are in a more clear way. Lot of the elderly do suffer with some amount of forgetfulness and some amount of having poor social communication whenever they have hearing loss. They do not want to express it, they are too proud to express all these problems, but generally the family will notice that they socialize lesser than what they were doing before. They start forgetting things more often, which is very small day to day activities, which is not a good sign, because deafness leads to progressively not attended will lead to slow dementia and also depression, especially in the elderly. For the elderly, the only thing that is important in their age group is to have a good laugh, to have a good conversation, to socialize and to meet people and talk, because all other activities do get restricted unless and until they are way physically active as compared to others, but that is a rarity. When their communication is suppressed because they are unable to have a better listening language, so their expressive language also gets limited. For day to day activities, listening is very significantly important. That comes down, you will find them that they start forgetting things, they start staying aloof in social gatherings, which is something which is not a good sign. Any form of hearing loss, if it requires hearing assistance, can be attended to at the right time. Intervention is very good because the adaptability of the patient becomes much more comfortable, the ease in which they use the device gets more comfortable, rather than bringing them at a stage where they are not convinced anymore to use any device, or they say that I am too old now to wear anything. So, that statement is totally wrong, because life expectancy is only going to go higher. Saying that I am too old to use anything is again wrong. You are as useful as anybody on this planet up to your last breath. So, never ever feel that you should not be hearing till your last breath. All options are available, starting from a hearing aid to a simple cochlear implant surgery, which can be easily done and revert back the profoundly hearing deaf people. This is an option not for as an option wherein when you have no choice or anything, but these are options which have to be applied at the right time at different levels of hearing loss. It is very essential to get yourself checked as you grow older, and pretty sure that many people will have a very good life expectancy. Just as important as your vision is, the same way the hearing is also equally important. Deafness is no more a disability to be shy of or to be having a social taboo, but is something to be embraced and treated at the right time. For any queries, you can visit us at Aster RV. We are here to help you. Thank you.